Good afternoon, all. I'm pleased to welcome you to the Feeling Your Best with Bronchiectasis Medication Management webinar with Christina O'Connor, PharmD and Assistant Professor of Pharmacy and Medicine at the Mayo Clinic College of Medicine and Science in Rochester, Minnesota. My name is Christina Hunt, and I'm the Director of Bronchiectasis and NTM Research and Education, and I will be your moderator today. This webinar is being recorded and will be made available for future viewing. Before I get started, I wanted to mention that we'll be muting your microphones throughout the presentation. If you're new to the Zoom platform, you're going to notice a bunch of icons down at the bottom of your screen. Throughout this webinar, we're going to leave your mics muted, but if you have any questions that you would like our expert to answer, I invite you to place those questions in the chat. You do so by clicking on the chat icon and entering a question in the box. We will try to get to as many of your questions as we can at the end of the presentation. We have organized this webinar for patients and caregivers so they can feel their best and better manage their bronchiectasis medication. On July 1st, 2022, we declared World Bronchiectasis Day to be observed annually. World Bronchiectasis Day aims to raise global awareness, share knowledge, and discuss ways to reduce the burden of bronchiectasis for patients and their families worldwide. We are very excited to be celebrating World Bronchiectasis Day again in 2023. We thank our community for their support of this day, and if you're curious to learn more, I invite you to visit www.worldbronchiectasisday.org. And without further ado, we will begin the webinar. I want to first start out by introducing our presenter today. As mentioned, Christina O'Connor is Assistant Professor of Pharmacy and Medicine at the Mayo Clinic College of Medicine and Science in Rochester, Minnesota. Christina O'Connor obtained a PharmD degree from The Ohio State University and completed a PGY1 pharmacy residency at the University of Toledo in Ohio, followed by a PGY2 pharmacy residency in infectious diseases at the Mayo Clinic, Rochester. She is currently a pharmacist supervisor and practicing clinical pharmacist at Mayo Clinic in Rochester, Minnesota. Her clinical interests include pharmacotherapy of pulmonary mycobacterial infections. She has 5 children, has ridden a bicycle across the states of both Minnesota and Iowa, and hasn't met a houseplant she can't kill. We welcome you, Christina. Thanks for joining us.
Thank you so much for the warm introduction, Christina Hunt, and thank you so much for having me. This is an honor. So today I'm going to be talking about medication management as part of the Feeling Your Best with Bronchiectasis series. The objectives for this talk: by the end of this talk, we'll have reviewed the general landscape of medication use in the United States. We'll have identified common challenges with routine medication use, and we'll implement practices that can decrease barriers to optimal medication management. And throughout the presentation, I'm going to invite you to add your comments and your thoughts in the chat box, and hopefully this can be a participatory exchange with us, because I've really found through the years, I've been doing this, working with patients that have complex medication regimens for about 10 years, and are prescribed at least one prescription medication drug. And about 2 out of 10 use 5 or more prescription medications. Medications are a key component of many disease treatments. However, only there are up to 2 to 3 of 10 prescriptions are never filled. They're never picked up from the pharmacy by patients. And of prescriptions that are filled, about half of these are not taken as prescribed. So maybe you find these statistics to be surprising to you. Maybe you don't. Maybe this is something that perhaps resonates with you. Having worked in pharmacies in the early part of my career, this is not surprising as we return many medications back to the bottles and back to stock at the end of the day every day that were never picked up. But I do find that these facts and figures really surprise my physician colleagues. They're often surprised to hear that patients don't always pick up their medications or don't always take them as exactly as prescribed. So why might this be? There are several underlying factors that have been identified. One of the reasons, and I think it's important that as healthcare providers, we recognize our potential contributors, is that medication regimens can be burdensome and they can be complex. And I think this is particularly true for folks that live with bronchiectasis, is often they may have complex regimens that involve both inhaled and oral medications, and they're difficult to integrate into your everyday life. There can be concerns about cost of medications as well as the side effects of medications. Doubts about the benefits of the medications that patients have. Low health literacy, which means that patients are not well informed about medications or their disease states. And I've added, so these are contributors that have been identified in the literature, and I've also added this one myself. I think being human can be a contributor. Just forgetfulness is something that patients report to me. That's just easy to forget taking medications, or people don't like taking pills or taking medications. And I think that's just part inherently of being human. So there's a lot of different underlying factors why it can be challenging to take medications chronically. There can be other reasons that medications don't work as intended, particularly with complex regimens where there's multiple medications. There can be drug interactions, and drug interactions can cause medications to either be more likely to give side effects or less likely to work well. It can go in both directions, which makes it even more complicated and confusing. Genetics can have an influence on whether medications are working as intended. There's a whole field called pharmacogenomics, in which your genetic predispositions can make medications more sensitive or less sensitive to you. Herbals can interfere with medications and either increase the risk of side effects or decrease the effectiveness of other prescribed medications. A person's own body metabolism. So some people are super metabolizers of drugs, and other people are very slow metabolizers of drugs. And that's very individualized. The absorption of the drug, there can be reasons that a drug doesn't get into the body very well. So it can be being blocked by another medication, or people can have had surgeries like a Whipple procedure or a gastric bypass that could also affect medication absorption into the body for pills that are taken orally. And then dose of the medication. Often dosing of medication isn't individualized to the patient. It's a one size fit all. So sometimes that dose could just be a little too high or a little too low for that particular person. But the way that drugs are approved oftentimes is a one size fits all scenario. So these are all other reasons that medications may not be working as optimally as they could be. So I'd like to invite you to reflect upon your experience with medications and how has it been? So how's your experience with medication management been? And invite you to put a chat, either a word such as, this has been easy for me, this has been challenging, or a sentence or two into the chat from the participants. If we have anybody brave enough to share, and if not, that's okay. Challenging. One person has added that it's been challenging for them. It is not pleasant. Yeah. Fairly easy. Time consuming. Okay, but Levaquin has terrible side effects. Extremely important. Challenging. A lot to manage every day. Challenging. The nebulizers are challenging. It's challenging to take an appropriate time to nebulize, but something I know I have to do. Produce dangerous fatigue, time consuming, not sure what medications are available, still cough all day, exhausting, too many to fit into a day along with the airway clearance times, time consuming, beneficial, a lot to remember. These are great comments. Difficult with many inhaled medications such as tobramycin and albuterol, very time consuming. A lot of side effects, life-saving, lost taste to meds, frustrating, rifampin lowered white blood cell count. Colistin is challenging to prepare, expensive, very expensive. No negative side effects. Nebulizing is a huge inconvenience to my life. Thank you for sharing these. And this is very common with what I hear in the clinic from patients. It's really a wide range. It's very individualized. Many folks find it very challenging. Many folks find it very time consuming to manage multiple medications. And on the other side of the coin, many can also are grateful for their medications and that they're life-saving and make them feel better. So it's really a range of different experiences, and it's very individualized. That's very much what I've learned from my patients. All right, let's move on from this. And I'd like to offer a framework, again, recognizing that experiences really vary across the board with managing medications. But folks have really looked to find and create a framework that can be used to fit a variety of different experiences to help optimize medication management. And one of the frameworks is called patient-centered medication management. And the goal, though somewhat, ambitious, is that care is both respectful of and responsive of individual patient preferences, needs, and values, then ensure that the patient's values guide all clinical decisions. And within that framework, there's 4 different tools or approaches that are taken. So there's shared decision-making, enhancing effective prescribing, taking patient feedback on their goals and their progress, as well as any setbacks, and optimizing medication behavior. So let's take a deeper dive into those 4 different approaches, starting first with shared decision-making. So the idea behind shared decision-making is that medical decisions are shared by providers and patients. And what shared decision-making is not is your provider just saying, okay, I don't know, what do you think? It's really supposed to be informed by the best evidence available, and your provider should share with you the best, the evidence as far as the medication, what has it shown, how might it be able to help, and what are the potential side effects. And then work with you to make decisions, weighted decisions using specific characteristics in your own values. So it's really understanding the evidence behind medications that you would be prescribed and working to make a good decision about those medications with your provider. So engaging in prescribing decisions involves the patient should understand and be communicated why a medication is indicated, the medication risks and benefits, and the likely impact on the patient's health. So let me give you a bit more of a concrete example. So this is a patient that we have, and their physician says to them, today we are going to be adding inhaled amikacin to your pulmonary MAC regimen. And I chose this example. This is the main patient population that I work with in my clinic with a pulmonologist at Mayo Clinic. So I just picked an example kind of near and dear to my practice. So this is what the physician is saying to the patient. So based on shared decision-making principles, what should be discussed about the new medication? And I'd like you to invite folks to put anything in the chat. So what should be discussed when starting this new medication? And I have the chat open and I can read if anybody wants to volunteer any thoughts. Side effects and benefits, the duration, excellent. Potential side effects, very good. Excellent. How to take it. This is cost, very good. What happens if it's skipped? Interaction with other meds, dosing, excellent. Risk of interactions, how long the medication has been in use in practice, great. How it will make you feel. Cost is a big one, excellent. Equipment needed, very good. All right. How to take with other meds and timing. Timing is a big one that came up as a challenge for most folks. 2, how to tell if it's effective, excellent. Talk about the clinical trial use, side effects. Is it okay with other disease states the patient may have? Let me see how soon it'll work and how soon it'll feel better. And if I don't read your comment, it's not intentional. I'm just trying to read as many as I can. There's a lot of good comments. Additional options, probability of benefit, and how it will affect the quality of life. Oh, excellent comments. Yes. And I captured most of those. So these are the things that I highlighted. So going back to the shared decision-making framework. So at a minimum, why a medication is indicated. So in this example, that the reason the medication would be indicated is because that negative sputum cultures were not achieved after a minimum of 6 consecutive months of multi-drug background regimen therapy. So that's kind of a technical description. I would hopefully be explained in a more kind of a patient-friendly, more of a discussion kind of tone. But basically that would be the indication for the medication, and that should be communicated to the patient. This is why we're adding this. We've gone 6 months. We've used all the other standard medication, and we have in the sputum cultures are still positive. So now we're going to try to add another medication to help with sputum conversion. So risks and benefits, that was a prominent one in the chat that most people caught. Excellent. So what are some of the risks of this medication? So the main risk and the most common side effect is potential for voice changes. But rarely there can also be hearing impairment or kidney impairment. Some of the potential benefits are shorter time to culture conversion and sustained negative sputum cultures. What is the likely benefit to the patient? How might you feel different? In this, based on clinical evidence for this drug, that it was demonstrated that patients have an improvement in the 6-minute walk test. So taking that for what it is, that's at least one thing that can be offered and explained to the patient. So I'd say at a minimum, as part of the shared decision-making scenario, this is the kind of information that patients should have so they can feel empowered about understanding their medication. And there were a lot of other really good suggestions that came up in the chat as well, some of which we will continue to get to. All right, so effective prescribing, and this goes along with some of the other suggestions that were in the chat. So the effective prescribing approach is to make sure to discuss solutions of any barriers to obtaining and taking medications. So some of those common barriers are medication cost, the timing in the administration, how it might be challenging, and adverse effects. The goal of effective prescribing is that taking medication, including how and when it is taken, is both doable and understandable to patients. So let's go back to our patient scenario, where today we're going to be adding inhaled amikacin to your pulmonary MAC regimen. So based on the shared effective prescribing principle, what should be discussed about the new medication? And I think we have captured a lot of that in the chat already. So I'm going to move on to talking about, the different components. So medication costs. So with this example, inhaled liposomal amikacin is typically expensive. It is often covered by insurance, but not always. And it typically involves paperwork. So at a minimum, this is what you would want the patients to be aware of, so that you know this up front and it's not discovered later in becoming a barrier. Timing and administration can, with this one, I think is a little less challenging than with the old inhaled forms of amikacin. That was the prepared from the intravenous formulation. That would be usually 2 to 3 times daily and titrated up. With liposomal amikacin, one of the nice benefits is it's once a day. So in that way, a little bit more of an effective prescribing technique to use the liposomal, integrating it into the day, but it still takes time to do these inhalations, and that has come up in the chat. So it is once daily, and it does specifically use one nebulizer system, the Lamira system. So I could see that as a potential challenge is that, you know, it's not that you can use it with the nebulizers of which you're using other medications for. It has to have its own nebulizer system that's generally provided by the company, but still it's managing a whole additional nebulizer system. Something for patients to be aware of. And then adverse effects, as again, we've discussed a bit, it's a common would be that it causes difficulty talking, and rare would be hearing toxicity. One thing that I like to advise patients to use, and I like to use in my practice with side effects, is the red, yellow, green stoplight framework for side effects. So when side effects are explained, I like to say whether something is an expected side effect, that's a green side effect. So something that we would say would be commonly experienced and that isn't harmful to the patient. So maybe some mild changes in voice for liposomal amikacin might be a green side effect. Yellow is cautionary. Let me know, let the provider know, but it's not a medical emergency. And then a red side effect is it's a medical emergency. Let your provider know right away, and then something needs to be done about it. So I like to use that framework to help contextualize not only if you get a side effect, what to expect of side effects, but then what to do if you get that side effect. So that's a nice framework that some providers will use, is that green, yellow, red side effect application. I'm seeing some good questions in the chat about nebulizers. Christina has directed me to let folks know that there's a lot of information furthermore about inhaled medications and nebulizers on their website. So to refer you to that, and maybe she can say a couple more words at the wrap up at the end. But we're going to kind of move on here. But thank you. I see those comments. All right. One of the other approaches is the patient feedback interventions. So this is addressing unanticipated barriers and answering new questions that arise while on a prescribed treatment regimen. So some examples of this is if it comes up that a prescription is not covered by insurance, allergic reactions that happen while on the medication, or other adverse side effects, or the medication does not seem to be working for the patient. Effective feedback is facilitated by patient-provider communication and is followed by an efficient process to modify the treatment plan as needed. So let's turn back to our patient case scenario. And now the patient has been taking the inhaled liposomal amikacin, and she has a new ringing in her ears. So what should the patient do next? If people could volunteer what they think that the patient should do next, if they have now a ringing in their ears, and add that to the chat. Okay, inform the provider, report it to the healthcare provider. Excellent. Contact provider, very good. So this is what I would call a yellow or a red side effect. Excellent. Stop the med and contact the provider, very good. Okay, and those should go together. A lot of times I'll have patients that'll say, hey, I stopped the med 2 or 3 days ago, and because they're having a side effect. And we like to know as soon as possible. I'd stop the medicine and then take direction from the MD. And it sounds like everybody in the chat is pretty well informed about what they should do. Excellent. So contact the provider. Have contact, and while that may seem somewhat obvious, I think this next part is what I find that people often haven't been provided, is that contact information for who they should contact if a side effect occurs in their hours for which they can be contacted, and then knowing what signs and symptoms to contact for. The provider should give a mitigation strategy. So I agree with those that put in the chat, hold the medication in this case and obtain audiology testing. And then determine a follow-up plan with the provider. So what are we going to do now that we've held the medication? And in this case, an example might be return to the clinic within 2 weeks for an in-person assessment and see if things have gotten better and follow up on the audiology testing. All right, moving on to our last approach, which is medication taking behavior interventions. So this is the use of effective tools to inform patients and enhance accurate medication taking, provide systems and resources that aid in obtaining medications in a timely and consistent manner, and to offer options to help with medication taking at home. An effective tool should be accessible, understandable, and useful to patients. So my first, and I think most pharmacists' #1 medication taking tool is the reliable pill box. So I have a couple different ones pictured here, and I will also start by saying pill boxes, I will fully acknowledge pill boxes are not for everyone. Pill boxes work really great for some people, and for other people, pill boxes are just not that helpful. And it's a very individualized kind of thing. What I tell folks is the one thing that I really like about pill boxes is it takes that burden off the patient of having to try to remember, did I take my medication today or not? Because I can't remember for sure. If the pill's not in the pill box, you're very likely took it that day. This is a tool that I use myself. I recently had a son and I was on a prenatal vitamin and I had that pill box just for one pill. Just, you know, sometimes people will say, well, I take one pill once a day or something like that. I'll use a pill box for one pill once a day, because if that prenatal vitamin wasn't in there, I knew that I already took it that morning and I didn't have to worry about it if I wasn't sure later in the day. They come in a lot of different styles. And so I have an AM, PM one pictured here, as well as a travel pill box. So the travel pill boxes are nice where you can take out and put it in a purse or a pocket. If you're going to be out, say for dinner, and you have a dinner medication, you can tuck one of those little travel pop-out pill box parts. And then just, hey, you've got it there. You can take your pill with your dinner if you're going out to eat. So I like those a lot. There's also keychain pill boxes, which are also pretty handy. Then you can, you know, if you're going to be going out, it's right there on your keys. You have an extra pill there if you're out and about that you can take. Those are also handy for as needed medications. If you're out of the house, you have it right there on your keychain. So those are some different, some of the benefits of using pill boxes. Pill packs. Pill packs, you know, these are kind of mutually exclusive with pill boxes. So typically people are going to use a pill box or a pill pack. In a pill pack, some pharmacies will offer this option. Some pharmacies will charge an extra fee, and some will do a pill pack for no additional fee. But basically, if you work closely with your pharmacist at a routine pharmacy that you go to, they can package your medications all into sort of like your dosing per day. So in this, you can see this pill pack, like your morning doses are all in one little bubble, and then your evening doses are there all in one little bubble. So all you have to do is punch out that time and day, and then take what's pre-packed there for you. So they can come in cards, or they can also come in these little, we call them blister packs. So this is usually available more likely from like a specialty or a independent pharmacy. You'll often see, though I want to say that Amazon may also potentially offer pill packs these days. Though I haven't directly worked with that service or had anyone that used it yet, but some people also really like pill packs. They say it's a lifesaver. It saves them a ton of time. They don't have to fill their pill boxes. And other people say it just doesn't work for them, particularly people that are titrating their medications up and down. Pill packs aren't always the best for. So if you have something where the dose changes a lot, like the blood thinner warfarin, oftentimes having that preset pill pack isn't quite as good because it's already set. And so people are taking pills out and adding them. Then usually a pill box is oftentimes better than a pill pack. Another tool that a lot of patients find useful is a phone app. And so these are generally like reminder apps, and often they're integrated with other health information that you can input into the app. And these three are free ones. They're typically, the base model is free to download. And all three of these, I know that Mango Health works on Android and iPhone. MediSafe, I believe, also works on Android and iPhone. And often what these are is you can put your regimen into the phone app, and then you can tailor reminders to your phone to remind you to take your medications. The Mango Health is kind of a neat one because it sort of gives it sort of like points. If you remember to take your medication, it gives you points, and then it can unlock, small gift cards or lottery for small gift cards and things like that, at least on the last version of the Mango Health that I saw. MediSafe is the most popular one. It's typically rated number one by most websites, and then a lot of my colleagues also recommend MediSafe, so that's another good one to check out. Round Health is one that I learned about researching a bit for this talk. That one is supposedly kind of the most streamlined, and it really just kind of reminds you to take medications, whereas the other two integrate other things like you can input your weight, your blood pressure, other kind of health metrics, whereas Round Health is much more streamlined into just that medication taking and reminding portion. Some folks find this to be apps to be a little too much extra, and often will just use a regular alarm either on their watch or on even an old-fashioned clock, if you will. But a lot of people find these apps to be helpful. A medication schedule or a calendar. So I've seen patients that have their own medication schedules and calendars that are simply amazing, and helps to keep them organized. Other people find that a medication schedule or your calendar is just one more thing to do. So again, very individualized, whereas some people find certain tools to be really helpful and others find other tools to be really helpful. But I've seen some really amazing patient written medication schedules. And these are always so nice for a healthcare provider to look at. And I would encourage, if you do have a schedule or a calendar or a good medication list that you use, to bring it to your healthcare provider appointments too, so that you can show them your list and people can visually see what you're taking for your medication record. But oftentimes these are going to have some identifying information, and then what the name of your medication is, what the dose is, the time of days that you take it, and some area for any notes. So those can be really handy to keep organized and on a schedule. A dose titration calendar. So this is a little bit different than a schedule, which the schedule is usually once you're on like a routine regimen. This is my routine regular regimen. A dose titration calendar is typically, we use it whenever patients are starting a new complex regimen. So again, focusing on some of my clinical background and where I practice, oftentimes meeting with patients and starting them on mycobacterial pill regimens, and those can be rather complex, involve multiple medications with potential for many side effects. And so in our practice, we phase those in one at a time, in either a new one every 3 days or a new medication starting every once a week. And this is provider specific. Not all providers like to do or choose to do a dose titration phase in, but this is one of the tools that we commonly use at my institution. And so we'll take this information here and put it in an actual calendar form for the patient to help to get them started. So that it'll say on day 1, you start with ethambutol and you take 1 tablet that day. On day 2, you increase that to 2 tablets. And on day 3, 3 tablets. And then on the 4th day, you add in that second medication. So we're adding slowly but surely and phasing in those medications. That helps both with toleration. Patients seem to be able to start the complex regimen a bit more easily, and then decreases potential further side effects as opposed to starting like 9 pills all at once. And then it also can help us kind of sort out if there's a side effect like a rash or something that pops up right away, to associate it with which medication was most recently started, which is very challenging if 3 medications or 4 medications are all started at once. So this is another tool that we use to help ease in some of these more complex regimens. And some general medication taking tips that I wanted to offer, again, from my years of learning and listening to patients, sharing different things that they've done and tried and have been successful for them. And I saw this one come across the chat, is knowing whether you can make up a dose or not and what the timing for that would be. So especially important for medications where it's important not to miss doses that you should be taking routinely every day, is knowing that if it has to be taken at a certain time, and how much window do you have to make it up. So commonly a general, but not always applicable, but generally applicable, if it's a once daily medication, we will often have about a 12-hour half-day window to make up a dose if you forget it to take it at the regular time. Again, that's a generality. Don't apply it to all your medications, but it's asking your provider that question. Okay, if I am taking this pill every day, how much time might I have to make it up if I forget to take it? That can, oftentimes people don't know that they can make up a dose or what the window would be. So it's asking those questions, get that information that can help to decrease missed doses. A med alert bracelet, I think this is something that, I think patients have brought up to me, and I think can be something that's really helpful. So if you're on a lot of medications, especially ones that are higher risk, like blood thinners, wearing a med alert bracelet that helps to inform emergency personnel. If anything were to happen, they know that you're on medications. And then also a medication list in a wallet or a purse, I think, is also really smart. Just keeping a copy of that in case anything were to happen, people can pull that up. I think that's really helpful, especially for folks that are on mycobacterial treatment medications that could have drug interactions, to just have that information available should there be an emergency situation. Caregiver support cannot be underestimated, how very important it can be. And again, this is very individualized. Some people have a lot of caregiver support. Some people manage everything on their own. But oftentimes, even caregiver support can be as seemingly as small as someone saying, hey, did you take your meds today? And reminding you. I've had some patients who have done like a medication buddy, where they have a buddy that texts them every day or periodically to say, hey, I'm here supporting you. Did you remember to take your medications today? And they set up a relationship like that has been very helpful to them. So taking medications can be a team sport, and something that I've seen has been really helpful for some patients. A word on herbs and supplements. Herbs and supplements they're very common. I'd say most patients, but not all, but many patients that I meet with are on herbals and supplements. And so, the things that I want people to know most is just being aware that herbs and supplements can have interactions with your other medications. So that means that you want to make sure that your healthcare provider knows what herbs and supplements that you're taking that aren't prescribed. So whenever whoever it may be at your doctor or your advanced practice provider office appointments sits down to do your medication, go over with you, don't just give them the prescription medications that you take, but also make sure that they know what herbs and supplements and over-the-counter medications that you're taking as well. So they can put that on your medication list so that people can screen for drug interactions, screen for potential side effects. Because just like I tell folks, just treat them like it's like almost like a prescription medication. It can have all the herbs and supplements can have all the same things that prescriptions can, as far as side effects or interactions. So making sure that your providers have that awareness of any herbals and supplements that you take. And then also I say, if you start an herb or supplement and you're, particularly if you're going for like a symptomatic kind of side effect relief, common would be like a probiotic that people will take. If it doesn't seem to be helping you, you don't have to be committed to take it forever. Sometimes you can do, say, a 2-week trial or a short period of time on that herb or supplement. Don't feel that you have to be committed once you started to take it forever if you don't feel like you're benefiting from it, and make sure your provider knows, ideally before you start. So again, they can screen for any interactions with other medications. And keep an accurate medication list. So going along, just piggybacking on the herbs and supplements, as a pharmacist, I greatly appreciate, and I will sit down and go through line by line, every single medication, herb, supplement, over the counter that a patient is taking, because all of those things can impact your health, impact your other medications, and keeping that list up to date so that everybody is knowledgeable about your current regimen can be so helpful and beneficial to you, because then folks can really understand your whole health picture. Okay. All right. So I think we touched on this. What has worked well for you? So if people want to share a little bit, so of these medication taking tools, what has worked well for you in managing medications? Has it been a pill box that's worked well for you? Has it been a list, an alarm? Again, I'll invite you to add into the chat. And someone has already volunteered to use my chart if available to keep track of medications. Learn the difference in the units. I love that comment. So what's the difference between grams, milligrams, micrograms, etc.? That's excellent. Yeah, that can make units are so important and can be often overlooked. Pill boxes have been helpful. Okay, pill box works best for many. Excellent. Yeah. Sometimes people have too many pills to fit in one pill box. Yeah, that can be a challenge with pill boxes. And sometimes, again, some people don't find a pill box to be super useful to them. And I also will say too, sometimes I'll recommend to use 2 sets of pill boxes. So one for, say, your blood pressure, cholesterol, and all that, and another for mycobacterial medications. Like, so sometimes people use 2 different sets of pill boxes when they have a lot, or you can get like supersized pill boxes. But then sometimes people just say, I'm just going to use the bottles because I have too many. Pill box and alarm, making sure not to run out and that refill them on time. That's another good one. So sometimes often people will also set not only an alarm to remind them to take their medications, but to get them refilled. And a lot of pharmacies will have an automated refill reminder system, but not all do. Some need to be cut in half and they're too small to do that. One other tip is, at some pharmacies, I know my pharmacy used to do this, our pharmacist would cut pills for the patients. And again, it depends on the pharmacist you have, but it doesn't hurt to ask. So if we had patients who had difficulty cutting pills, or their pills were small or too small to cut, we would use we would cut it for them and provide it cut for them in their bottle. Pill boxes work well for the morning. I have a bag of my supplements and I take those in the evening. Yep, a lot of people keep their supplements separate so that it's kind of like 2 systems that they keep track of. Travel is often a challenge. Yeah, absolutely. And it takes planning ahead. Another tip that related to travel is many pharmacies can do like a travel override. So for your insurance, so if you know you're going to travel and you want to get your pills all set and other meds set in advance, a bit in advance, some insurance will allow like an insurance override to fill them earlier so you can get prepped for travel. So it depends on your insurance, but that's always also something people can ask about when they travel. The other thing to know too is that you can transfer your medications pharmacy to pharmacy. So that comes up with my patients too. They'll say, oh, I missed my medications while I was traveling. and they didn't realize that they could have their prescription transferred electronically to a pharmacy wherever they were traveling to. And that can work really well, especially if you use like Walgreens, CVS, because they're all connected to each other. And so if you go to a Walgreens, say you're vacationing in Florida, they can just pull it up right there on the computer and fill your prescription there for you while you're traveling. So it's something that patients don't always realize. Yep. So very, very related comment. Use a pharmacy readily available in other cities like Walgreens, so you can do the transfers. Excellent. Yep. And make sure that when you fill your pill box, that use the appropriate dose of the med, increasing or decreasing, and have more than one bottle of medication. Yep. That's a common challenge that I will see too, is that when people have multiple doses, is making sure to keep all of those straight. That can definitely be challenging for folks. And using it, and that's another area where I say a pill box is easier than a pill pack in those kind of situations, because it's really hard to increase and decrease doses with the pill packs. Yep, the automatic refill text notification is a good one to sign up for those. That can help with refills. And often we'll also tell our patients to have about 5, like maybe about a week extra, if you can, of your medications on hand. And usually you can get a refill about 2 or 3 days before it's due, so you can build up a little bit extra. We try to say not to get too much more than a week on hand, because medications expire and things like that. But to have a little bit of a buffer that you can work with in case something comes up, because, you know, things that come up out of control, pharmacies closed for the holiday or something like that. So it can be helpful to have about a week extra medication on hand. Yeah. Yeah. Some pharmacies will also have like a refill syncing program, and not all pharmacies will, but some do, where they can, if you enroll in the refill syncing program, they'll try to sync all your refills so that they're at the same time, so that it's not, okay, I have to get a refill this day and then come back in another week and get another refill. They try to get them close so that you can do like all the refills at one time. And that's another slick tool that I've seen some pharmacies use. Okay. Some really good comments. Yeah, your pharmacist helps with syncing of the meds. Excellent. Good. Okay, great comments. All right, so, and I think we're coming just on time with about 10 minutes left for question and answer. So in summary, it's common for people to be taking at least one medication. Most Americans are taking at least one medication. So if you're taking a medication, by no means you are not alone. There are strategies that can help optimize taking medications. I've been meeting and talking with patients for 10 years about taking meds, and I've never had one that says that they like taking medications. So this is something that's hard for everyone. And there are some things that we can do to try to optimize that the best we can. Shared decision-making with your provider, get the knowledge, be informed, be proactive, advocate for yourself. Use effective prescribing and facilitate effective prescribing. So if something is a barrier or a challenge, let your healthcare professional know. Oftentimes we're surprised when we learn, oh, that medication is really expensive for the patient, or it's been really difficult to take this one or that one, because we just don't know. So share with your providers and let them know whenever something is a challenge, and they can think about whether there's something that they can do to change to help that. There's not always, but at least having that conversation and opening that door to talk about if there are options. Feedback and intervention. So give feedback as you go along, especially understanding potential side effects and reporting those back to providers as relevant. And then medication taking strategies. I think we've talked about a lot of great medication taking strategies. And the main thing that I've learned over the time is it's not one size fits all. There's something that works best for you, find what it is, and then stick with it. And that's going to be the most effective thing at all, is when you find something that really works for you. All right. I'd like to thank you for your time and for your participation today. And I will open it up to the floor to a question and answer session. And I see Christine is back. So if you want to go through, if you can offer me up some questions, because we've had a lot of good activity in the chat, but if you could help, if folks want to volunteer and add any more questions, maybe Christina can help pick some out for me to answer.
Christina, I wanted to feed you one real quick, and before they start flooding in, could you just review again what are some major red flags or things that folks that if they may be experiencing a side effect that they should definitely call you or their physician and notify you about? I think some folks are worried about, whether they're allergic to a medicine or if it's a severe side effect. What would you encourage at that point?
I would say, a lot of times patients on kind of sense that something is not right is often in and of itself is, if you feel like something's not right, you should let somebody know. So your own intuition is very important in the general broad sense. If I'm not talking about like one specific medication, is trust your own intuition. If something doesn't seem right, report it to a healthcare provider, I think is just a general kind of blanket statement. If I was going to say more specific, like signs or symptoms, allergy is a big one that we get reported to us. So if you're having like a rash, especially any shortness of breath, if anything is swelling on your body anywhere, eyes swelling, lips swelling, anything swelling, oftentimes that's either the emergency room right then, or possibly if it's just the rash, reporting it to your healthcare provider. I'd say that's universal with most medications because an allergy is really possible with any medication. And so that would be one that I'd say is a bit more universal. And then otherwise, it's really understanding individual medications and saying, okay, what's my red light side effect for this medication? And then just kind of being aware and knowing what those are and what steps that you would take in your own individual situation.
Thank you for that.
Yeah.
There's more questions in the chat. Let's see here. They have specific questions about side effects from specific medications. Should they refer to their pharmacist for specific questions regarding specific medicines, or do you find that there are some overall side effects that are general with just taking medicines that are for bronchiectasis patients?
Yeah, I see tobramycin is a common one that's coming up and in the chat. And again, I try to keep this a bit more of just a general talk because everybody has their own individual medication regimens that they could be on, but tobramycin is coming up commonly. So for inhaled tobramycin, I'm presuming the question is about inhaled tobramycin. So in general, inhaled
It appears that, Christina, I don't know if you can hear me. It sounds like your audio has paused a little bit. I don't know if you're still with me. I think her audio has paused. And so if we can get Christina back to answer a few more questions, we will. Here she is. I can hear you.
My internet went down for a second, but I'm glad that it held through the presentation. Yeah, so generally inhaled medications tend to have less side effects than if something's given by an IV, but not none. And so then of course other pulmonary kind of side effects like bronchospasm are also possible with inhaled medications in general, but inhaled tobramycin tends to have less side effects than getting it through the IV, but the same side effects are possible as through the IV, but much more rare. So those kidney function decrease as well as hearing changes. Good question.
I had also another question that comes up pretty frequently, especially during around hurricane season. How do patients with bronchiectasis or really any lung condition, how do they prepare with their medications prior to a disaster? If they live in like a hurricane zone, or, you know, they're expecting lots of snow, like you may get up in Rochester, Minnesota. How did those folks prepare for those types of things, like natural disasters, weather-related things ahead of time? Because I know they tend to worry about that, you know, when something like that's headed their way.
Yeah, that is a good question. So that's where having a little bit of that stock up of your medication can be helpful if possible. So trying to have like about a week's worth on hand, and usually that can be by getting refills a little early, like a day or two early, and do that consecutively for several months is what we usually recommend until you have about a week on hand. That's one way that you can kind of prep. And then otherwise, well, we don't have a lot of hurricanes in Minnesota, so I'm not always thinking about it, but being aware of if you have any medications that are sort of sensitive to moisture, just being aware of which ones those might be. And if you have any kind of like waterproof kind of containers or things of that nature, having those readily available where you could store your medications. So like a Yeti kind of thing comes to my mind, to have one of those on the ready that you could put your medications in to kind of protect them. Usually medications are sensitive most to water and temperature excursions. So really hot and really low and really cold. But most medications actually are fairly durable to both of those things. And oftentimes they'll come with a warning if they're not durable to those things. So moisture sensitive medications will often have a warning on them, or they'll be prepackaged in a bottle that says that it's moisture sensitive. So those are usually called out to you. And then oftentimes ones that have to be like in the refrigerator or something like that, those are also often clearly communicated, like this is a refrigerator only medication. So usually the ones that are really sensitive to those kind of things that is usually informed to the patient. Most pills in general are pretty durable to the other two type of influences, but those are the two things that can kind of degrade the quality of a medication, is usually that temperature excursion and moisture. Good question.
Thank you for that. We're going to take one more question from the chat, Christina. Let's see here. So if somebody is experiencing hearing loss as associated with taking medication, is it your experience that the hearing will return after taking the medication, or is that something that they need to kind of think about before taking the medicine, that it could affect their hearing moving forward?
Yeah, the ones that I think of, again, with tobramycin with hearing is a big one. Amikacin is another one that can affect the hearing, is that those can be irreversible. If it's caught early on, then it's more likely to be reversible. So the sooner that you experience some potential change in your hearing and report it to your healthcare provider, the better. So that if the medication does need to be changed or held, there's a better chance of having that recover if it's caught earlier on. But if it keeps going, there is a chance that it could be irreversible. So being really proactive. And then we typically recommend at our institution, for those that are getting it through the IV, we're very proactive with a hearing audiology test once at baseline, so before starting the medication, and then either once a month or once every 3 months. And that may not be necessary for the inhaled form, again, because that has a lower risk of side effects, but we're pretty proactive about that with those that are getting it through the veins just because of the risk. So being your own patient advocate, if you sense anything is different, some people will say, It can be a ringing in the ears is the one that most people will know to look out for, but it also can feel like some patients will say a fullness in their ears. That can also be side effect of amikacin, tobramycin. They're called the aminoglycosides. And then also balance change, so dizziness, because your balance is also regulated by your ears. So that would be another thing that you would want to report. And then muffled hearing would be the other thing. So it's kind of different types of hearing changes, and just being cognizant and being on the lookout for any of those types, not just the ringing in the ears that people often think of first.
Thank you for that, Christina.
Yeah.
Well, we have reached the end of our session here. And Christina, I want to thank you so much for presenting today and providing your expertise. It's just been an amazing webinar for our community. And we'd like to thank everyone in our community for joining today. If you aren't a member, we encourage you to join Bronch and NTM 360 social community. We welcome patients, caregivers, healthcare providers to join our community and keep the conversation around bronchiectasis and NTM lung disease going. By joining bronchiectasis and NTM 360 social, you will not only become part of an amazing community, but you'll also receive a monthly newsletter to keep you updated on future educational events like these, and social events and potential research opportunities as well. I invite you to post any unanswered questions from today's event, because I'm sure we didn't get to all of those questions, but feel free to put them in the activity feed of Bronch and NTM 360 social. Our community loves to engage and provide support to those who wish to learn more about their diagnosis. And just a reminder, join us in supporting World Bronchiectasis Day on July 1st. Thank you, guys. Have a great night. Bye.
Thank you. Bye.